Good evening and good morning to all of you. So, we are here for the next class on Organon of Medicine. So, till last class, we have talked about what is the sick, what kind of cure is called the ideal cure. Then the third aphorism was about what should be the basic knowledge of a homeopath or a physician, first physician, so that he can make himself able to cure the patients. Then next we did what are the basics which we need to interrogate or ask in the cases of acute disease or the chronic diseases. Then the last aphorism which we discussed was about the unprejudiced observer, that a physician should be an observer who is basically does not have any kind of speculations, does not have any kind of um, like Dr. Henneman says that the first come of the physician is to cure the sick, not to speculate or make some theories about how the disease is coming or how the medicine is. These are not his primary works. The primary work which should be there in his mind should be to cure the sick. So, how becoming an unprejudiced observer, one can see those deviations, how the person has got sick, what are the things which have got sick in him, and how to cure that. So, that is a role of the unprejudiced observer, which a physician should be. So, now we will uh, start with the seventh aphorism. So, aphorism 7, Dr. Henneman says, now as in a disease from which no manifest exciting or maintaining causa occasionalis has to be removed. Okay. So, like we have done that in the acute diseases, there is an exciting cause which causes the disease. Or then there are some diseases where there is some cause which is maintaining something. Like for example, if you are wearing a tight shoe, there is an ulcer developing in the back of the heel, or there is some eruption developing in the back of the heel, which can be cured by just changing the shoe or removing the shoe. So that shoe is an maintaining cause in such kind of diseases. For example, if someone is having cough from smoking cigarettes, then if you remove that smoking cigarettes from that person, if he can remove that thing from his regimen or his routine, then that cough can subside on its own. So in those diseases where there is some maintaining cause going on or some exciting cause going on, if now as in a disease from which no manifest or exciting or maintaining cause has to be removed. Okay, now we are talking about those diseases where the exciting or maintaining cause is not to be removed. Okay, we are not talking about those diseases where the maintaining cause or exciting cause are basically causing the symptoms. We are talking now about the natural diseases, the diseases which are coming naturally. Now, as in a disease from which no manifest or exciting or maintaining cause has to be removed, we can perceive nothing but the morbid symptoms. We are not able to see anything in those diseases except the symptoms. Okay, because there is no maintaining cause which is to be found in chronic diseases. There is no exciting cause. For example, some patient is having heart trouble from past 6 or 7 years, We have told him everything which he can do in his routine. So when we investigate, we are not able to find any maintaining cause for this heart disease. We are not able to find any exciting cause for this heart disease, because this heart disease is a natural disease which has come to him. So in those diseases which are coming naturally, we can perceive nothing but the morbid symptoms. We can not understand anything else. We cannot see anything else except the symptoms there. It must regard being had to the possibility of a miasm and attention paid to the necessary circumstances as given in Aphorism 5. Okay. So it must be the symptoms alone by which the disease demands and points to the remedy suited to relieve it. So the whole thing means is, in those diseases where no manifest exciting or maintaining cause can be removed, we don't know what has been the exciting cause or maintaining cause, because the disease has been going chronically, or disease has been going because of some natural state which has developed in the patient. Except the symptoms, we can only see symptoms in them, and be the symptoms alone by which the disease demands and points to the remedy suited to relieve it. So only these symptoms can tell us about the disease. For example, if someone is suffering from heart disease, if there is some pain here, if he complains about the dyspnea on exertion, only those symptoms can tell us about the disease. Only those symptoms can tell us about the state. And those symptoms are basically which points to a remedy also. They tell you that this is something wrong in this man, in the sick, and he needs some remedy so that he can be relieved. So main Dr. Henneman is trying to tell here is that these symptoms, they are the guide. They are the indications which tell that a person is diseased. And they are the indication which basically tell us what kind of remedy should be given to the patient. And moreover, the totality of these, its symptoms of this outwardly reflected picture of the internal essence of the disease, that is of the affection of the vital force, must be the principle or the sole means whereby the disease can make known what remedy it requires. And moreover, when you take this totality of the symptoms, you totality means you are taking symptoms of the whole man, not of some particular part of the man, not of his heart, not of his knee, not of his mind, but the symptoms of the whole man. So when we take this totality of these symptoms, the total symptoms of this outwardly reflected picture of the internal essence of disease. What are these symptoms? This totality is basically a reflected picture. There is something going wrong inside the body. Inside means not just the at the level of tissues or the organs, but at the soul vitality of the person. Today also I was discussed with some of my students. Uh, we were basically discussing about organ only, that what are the things which make a disease chronic. Okay, how the natural disease starts. And there are basically two states of the body. One is the healthy state, and then there is the disease state. How a person gets deviated from the healthy state to the diseased state, what affections he has got, what kind of disease he has got, that can only be told by the symptoms. Nowadays, many times the patients come that we have gone for a regular checkup and doctor has told me that you are suffering from diabetes. But there are no symptoms of diabetes. The patient is not at any kind of dis-ease. Disease means dis-ease, that the patient is at some difficulty in his ease. He's not easy. He's not comfortable. So, but the patient says that I'm okay. I don't have any problem. This was just an accidental finding. So when there are no symptoms, should we just look at the numbers? Body is not numbers. Human, we are living people. We have sensations, we have functions, we can tell how we feel. If someone is feeling healthy, and by look also he is healthy, he's not having any kind of symptoms, so how can I say that that person is diseased? Because disease, whenever there is in the inside, wherever it is, the only way a person or the body can tell that they are diseased is by basically outwardly reflecting the picture of the internal disease in the form of symptoms. So symptoms are of primary importance. This, as a homeopath, we have to understand. For example, if there was some accidental finding of someone's this chest, some lung, that there is some small tumor or some nodule inside, but the patient has never complained of any difficulty in the body. The patient says that I breathe very fine, I do exercise every day, I'm going to the gym also, and I am having all the my social meetings and social gatherings. I go there. I have never felt any kind of problem. So how can I say, just by looking at a small tumor or some nodule, should I say that, oh no, you are sick? The patient is saying the opposite thing, that I'm not sick. I don't feel sick. But then basically I am passing my thought to the patient as a doctor that no, you don't know, but there is some sickness inside you. If the patient, okay, sometimes the patient might not feel, but he's losing weight, he's losing appetite, he's losing sleep, but he might not feel that, then the doctor may say that no, your this generals are not good. The basic things which should be good, the appetite should be good, the weight should be maintained, or this thing, but you, in your case, they are not good. Then okay, as an observer, I can say that there are some symptoms. These are also symptoms. So on my observation, I have seen that there are some symptoms which are not well in the patient. But if they subjectively also and objectively also, we cannot find any symptoms, how can we say that the patient is basically diseased? Because as a homeopath, like I was discussing today, we are not basically trying to cure any diseased organ or diseased part. We are going to cure the sick. So the sensations of the sick, the feeling of the sick, the look of the sick, they are very much important for us. So we have to always remember this thing, that these totality of the symptoms, all the symptoms of the body, they basically represent an outwardly reflected picture of the internal essence of the disease. Whatever the disease is going inside, in whichever part, it will be reflected out in the form of symptoms. That is of the affection of the vital force. Must be the principle, and they should be the principle, or the sole means, and the only way whereby the disease can make known what remedy it requires. So first, the symptoms tell the physician that the body, my man, is basically sick because the vital force is not functioning properly. So this man is sick. And the same symptoms, they basically tell us what remedy to give. That is the only mean. How else can we find a remedy? Even in all the pathies, in allopathy, in Ayurveda, whatever there is, they also take the symptoms to understand which kind of remedy should I give, which kind of medicine should I give. The basic diagnosis is also made on the basis of symptoms, although they are taking the common symptoms and we are taking the uncommon symptoms. But the basic diagnosis is also made on the basis of symptoms. So symptoms hold the primary importance in selection of the remedy. The only thing that can determine the choice of the most appropriate remedy, and thus, in a word, the totality of the symptoms must be the principle. Indeed, the only thing the physician has to take note of in every case of disease and to remove by means of his art, in order that it shall be cured and transformed into health. Just the difference here is that the other pathies or the other system, they basically take the symptoms of the disease to give a remedy, to give a medicine. They take the symptoms of the disease. They take symptoms of diabetes. They take symptoms of gastric disturbance. They take symptoms of urinary tract infection. They take symptoms of upper respiratory tract infection. But as a homeopath, Dr. Hahnemann says that in a word, the totality of symptoms, all the total symptoms of the body of the sick man must be the principle. We have to take all the symptoms. We cannot just and divide the body into some small parts and focus on those small parts. We have to see the whole. We have to see the whole man and take the totality of the symptom, all those symptoms which are important in the whole system of the man. Indeed, the only thing the physician has to take note of in every case of disease. And this totality is to be taken in every case of disease which we are seeing. Because in every case of disease, we are curing the sick. And to remove by means of his art, in order that it shall be cured and transformed into health. And with our art, now this is a very remove by means of his art, personal, of the physician. Dr. Hahnemann is giving us the manual, this organon, like I told you. Science and art, we have talked about that thing in the beginning. Dr. Hahnemann is giving us a manual to understand the principles of homeopathy, to understand how we have to cure the sick. This is a manual, this is a science which he's telling us about. But the physician has to apply his art, what he has learned, what his knowledge has developed up to, and he has to use that knowledge as an art again, and to remove by means of his art in order that it shall be cured and transformed into health. He is not using the word skill, he's not using that you can use my given knowledge or my organon, or you can use my materia medica. No, he's saying that it is your art, his art, physician's art of understanding the case, and the art of application of the principles. We have to know these principles, that this principle must be the principle, but the totality of the symptom. This is a principle that in every case we have to take the totality of the symptoms. We cannot divide the case into small diseases and give this belladonna for headache, and some digitalis for heart, some kalikar for the lungs, because this kind of medicines, they are this kind of practice is also done. They also call themselves homeopaths. That is not homeopathy, because it does not is based on the principles of the homeopathy. The principle, the first principle is told in the Aphorism 7. Not the first, but also the one of the principles is told in Aphorism 7, that the it is a principle to take the totality of the symptoms, because that is the only guide which can help us to choose the remedy. And the physician has to develop his art based on these principles. Then there is footnote to this aphorism. It is not necessary to say that every intelligent physician would first remove this where it exists. Dr. Hanuman is saying that this thing which I'm going to tell, it is not necessary to say this thing, because every intelligent physician knows this, that if it is present, this thing which we are going to talk about, then that has to be removed first. Dr. Hanuman is actually going to talk about this maintaining cause, which we have talked about in the aphorism 7. So he's going to talk about it in his footnote, that what are the maintaining causes. So it is not necessary to say that every intelligent physician would first remove this where it exists. He will remove the maintaining cause wherever it is existing. The indisposition thereupon generally ceases spontaneously. So whatever disease or some symptoms are basically developed out of that maintaining cause, they will remove as soon as the maintaining cause is removed. For example, he will remove from the floor room strong smelling flowers which have a tendency to cause syncope and hysterical suffering. So if there is some person or some female lady, some who has this tendency to have some kind of fainting or some hysterical suffering by strong smelling flowers or some strong smelling smells, so we know that we have to remove that smell from the room, because this smell is basically the maintaining cause. Extract from cornea the foreign body that excites inflammation of the eye. If there is some foreign body which is basically some insect or some dirt or this thing has gone in the eye, which is causing the inflammation or the redness of the eye. So an intelligent physician would know that first that foreign body has to be removed from the eye. Loosen the over tight bandage on a wounded limb that threatens to cause mortification and apply more suitable one. Lay bare and put a ligature on the wounded artery that produces fainting. So he knows that if there is some injury and the bandage is very tightly bound on the some limb, and it is stopping the blood flow to the rest of the leg or rest of the hand, then he knows that he has to this lose the bandage, because that is the what common sense will tell us to the intelligent physician, that like, this thing does not need any remedy. You just have to lose the bandage. Because of the over tight bandage, this the blood is basically not flowing to the rest of the parts. Endeavor to promote the expulsion by vomiting of belladonna berries, etc. If someone has taken some kind of um, taken some belladonna berries or some kind of poisoning thing, so he will do something so that he can vomit out, giving some strong coffee or some salt water so that the vomiting can be induced. That may have been swallowed. Extract foreign substances that may have got into the orifices of the body. Okay, some foreign substance, something has gone into the orifice of the body. So he knows that first he has to extract that thing out. The nose, gullet, ears, urethra, rectum, vagina. Crush the vesical calculus. Okay. Open the imperforate anus of a newborn infant. If there is a newborn infant and the anus has not developed, so he knows that so that these things are basically surgical things which has to be removed or which has to be done. So this does not need to be told to the physician that these are the maintaining causes, and these maintaining causes, whenever they are removed, usually the sufferings which are happening because of them, they basically cease to exist. So there is some foreign thing or some this thing from the outside which is basically affecting the patient, and Dr. Hahnemann basically says in this that every intelligent physician knows this, that he has to remove. Then there is second footnote to the aphorism 7. The old school physicians, not knowing how else to give relief, have sought to combat and, if possible, to suppress by medicines here and there a single symptom from among a number in diseases. A one sided procedure, which, under the name of symptomatic treatment, has justly excited universal contempt, because by it not only was nothing gained but much harm was inflicted. So, in all the times, right from the beginning, when the medicine was known, the old school physicians, because they didn't know how to give relief to the whole body, to the sick man, they didn't know how to give the relief. So they what they would do is they would sought to combat, like fight with all those symptoms and suppress by medicines here and there a single symptom, some single symptom with some medicine. They will try to suppress or palliate that symptom from among a number in the disease. There were so many symptoms of the disease, but because they didn't knew how to give relief to the patient, they will prescribe medicine only for one single symptom. So a one-sided procedure, and it was also given the name of symptomatic treatment and was contempted by everyone. That this is not the way to treat a patient, because it was seen also that nothing was gained from it. No relief was given to the patient, but more harm was inflicted. The patient got more worse by such kind of treatment. A single one of the symptoms present is no more the disease itself than a single foot is the man himself. So, like a single foot, if you just look at the foot and you see that this cannot be the man, I cannot tell about the man just from looking at the foot. So, similarly, one cannot tell about anything about the disease by just looking at a single symptom. A single symptom cannot tell us about the disease or the extent of the disease. So this procedure was so much the more reprehensible that such a single symptom was only treated by an antagonistic remedy, therefore only in an enantiopathic and palliative manner. And the more harm what was done was that this single symptom was treated by a remedy which was antagonistic. Antagonistic means it will produce the opposite effect on the body. So obviously it was going to palliate, it was going to suppress the disease, whereby after a slight elevation means amelioration, slight relief, after slight relief, it was subsequently only rendered all the worse. So initially it would give a little relief, but afterwards it will get more and more and more worse. So Dr. Haneman is basically trying to tell us here the harm of looking at one or two symptoms and giving a medicine to the patient. Until and unless we don't see the totality of the case, the totality of the symptoms, we cannot understand about the disease, and we cannot understand about the man who is diseased. So very beautiful line Dr. Haneman is writing is a single one of the symptoms present is no more the disease itself than a single foot is the man himself. As you cannot understand about a man just by looking at his one hand or his one foot, you cannot understand about a disease just by looking at a single symptom. Because the man is a complete person. So to understand him, we have to see where nowadays this, not nowadays but from some past many years, this idea of super speciality has emerged. That one doctor is a specialist about intestines or the gut, stomach or the ear or the throat or the nose. So this is the same thing. We are just trying to understand the disease by looking at one organ of the patient. Who would you say will be a complete physician? A physician who knows about whole of the body, or a physician who just knows about the heart or just the gut or just the knee, just the eye? Who will be a more complete physician? What does the common sense tells us? So these kind of trends have set up, and the other physicians, I have also seen many intelligent physicians who are very good at their work. Just because the trend is like that, they also try to change themselves according to the trend. That okay, I have to also start a super specialty thing. The thing is that when you know about the whole man and the whole sickness, that in itself is a super specialty, because no one else is doing it. That is something special. When a patient comes to you and he can tell you about all of his body, his mind and his physical body, he can tell you about everything, and you can give medicine for all the things, one medicine for all the things. So what can be more special than this? This in itself is a super specialty. So coming to the next aphorism 8, it is not conceivable nor it can be proved by any experience in the world that after removal of all the symptoms of the disease and of the entire collection of the perceptible phenomena, there should or could remain anything else besides health, or that the morbid alteration in the interior could remain uneradicated. It is not conceivable. Conceivable means that the intellect cannot conceive it, intellect cannot understand this thing. What is it cannot understand, nor can it be proved by any experience in the world, and neither can it be there can be no experience in the world which can prove this thing, that when you remove all the symptoms of disease, what is disease? Disease is the totality of the symptoms in front of you in a uh, patient who is sick. Basically, when you have seen all the totality of the symptom, we call that this is basically his disease. And when you remove the totality of his symptoms from each and every extent of the body and of the entire collection of the perceptible phenomena, any phenomena which was, for example, even if the patient was feeling okay, but I was seeing that he's losing weight or he's not having his proper appetite, the sleep is not proper, after giving the medicine all these symptoms became better, became healthy. So he's saying that there should or could remain anything else besides health. When you remove all these symptoms, when you basically correct the entire phenomena, then the right mind can say that okay, all the symptoms are gone, every physical or sensations or the functions are now in a right place. So this is what is health. What remains besides? This is what the health is. That there is no disease. What is health? Absence of disease. There is no disease. There are no symptoms. The only way disease can tell itself is through the symptoms. So when there are no symptoms, that means there is no disease. And when there is no disease, that means the patient is healthy, or that the morbid alteration in the interior could remain uneradicated. Because there was this Huffland at Dr. Hahnemann's time. Dr. Hahnemann will tell us about in the footnote, who said that, okay, this is right that homeopathy can remove the symptoms of the patient, but the disease remains. He said this thing in a magazine. Huffland was a magazine. So the editor, he wrote this thing in the magazine, and the medical magazine at that time. And Dr. Hahnemann is basically telling about the intelligence of that line. That how can you conceive this thing? How can you even think about this thing? And okay, but there is no experience, or there is no evidence which can prove this thing in the world, that after the removal of all the symptoms, the disease will remain. Because disease is a collection of symptoms. Whatever the symptoms are present in the body, that is a disease. If you had some irritation in the eye, there was redness in the eye, these are the symptoms. That is why you go to a physician. The doctor, I'm having a problem. So he gives you some medicine and this thing goes away. So is the disease gone or it still remains? It is gone. The symptoms are gone. That means disease is gone. So the aphorism to the footnote 8, when a patient has been cured of his disease by a true physician, the right physician, when he cures the patient of his disease in such a manner that no trace of the disease, no morbid symptom remains, and all the signs of health have permanently returned. How can anyone, without offering an insult to common sense, affirm that in such an individual the whole bodily disease still remains in the interior? So he's saying that when the patient is already cured by a true physician, by a right physician, and in a manner that no trace of disease is there, we cannot have, and we don't have any sign, even a smallest of the sign, even a smallest of the trace of the symptom is not present, no morbid symptom remains, and all the signs are of health, and they have permanently returned from past many months or many years. He is in a healthy state. So how can anyone, without offering an insult to the common, this is insult to a common sense, because common sense tells us that symptoms mean disease and disease means symptoms. So without offering that insult to a common sense, affirm that in an such an individual, the whole bodily disease still remains in the interior. How can someone say no, but disease is still there? And yet the chief of the old school, Huffland, asserts this in the following words. Homeopathy can remove the symptoms, but the disease remains. This was the magazine page number and this. This he maintains partly from mortification at the progress made by homeopathy to the benefit of mankind. Because obviously, when a person who has a good, nice intellect and common sense, he can say that this does not mean any. This does not basically have any meaning. And when you then think about it, that why the Huffland would have said this thing, because this does not mean right. We know that any sound person can know. I'm not talking about the physician, but even a doctor, patient, or even a general common man, he will also say that this does not mean anything. I have a headache, I go to the doctor. I don't have a headache, why should I go to the doctor? I'm healthy, I don't have any symptoms, why I should sort any kind of medicine? Even he knows that disease means symptoms. So when someone thinks further, then he obviously this thing will come to the mind, that why Huffland would have made this kind of statement. Because Dr. Hanuman say that partly it is because of the mortification, the humiliation which he is basically feeling from the progress made by the homeopathy to the benefit of mankind, and partly because he still holds thoroughly material notions respecting the disease. That is the reason. There can be that in thing of humiliation, but the main thing is that till the time you hold this material notion respect to the respecting diseases, the disease is something which comes from the matter which is still inside. So until and unless we hold this material notion in our mind, we will always come back to this thing. No, that okay, the fever has subsided, but some kind of bacteria or virus is still there, which can cause the disease again, which he is still unable to regard as a state of being of the organism, wherein it is dynamically altered, where it is dynamically altered by the morbidly deranged vital force as an altered state of health. Dr. Hanuman is saying that he's still not able to understand this thing, that disease is basically coming dynamically when the vital force is basically affected dynamically. So when the vital force is affected, when it gets disease, it basically shows its symptoms outside on the body and tells us that there is some disease going on inside. And when we remove those symptoms, that can only tell us that the vital force is now again back to the state of health. But he views the disease as something material. So Dr. Newman is saying that he still thinks of disease as something material, which after the cure is completed may still remain lurking in some corner in the interior of the body. Today, not today, but today was a follow up actually. From some time, a patient is coming to me. So this lady, she had multi-organ failure. She was in hospital. She was on a deathbed, kind of deathbed, and she had the kidneys were not working, the heart was becoming weak, the lungs were becoming weak. The whole thing process started with the lung problems. She's an old asthmatic, and from few months she was having problem with his breathing capabilities. So she was hospitalized for that thing, where she developed this renal failure, and the heart was also failing. So the husband was already taking medicine from me, and he discussed the case with me, and we gave her a medicine. And this lady, after 15 or 20 days, she was discharged from the hospital. Her creatinine was at around 7, which came down to 1.3 or 1.4. Her heart was basically working at echo, I was showing 18%, and it went up to 32, 33%. The lungs became better. She was able to breathe properly. So all these things were becoming good. And I told the patient, the attendants, to get her discharge back, to take the discharge and bring her home, because the things, the antibiotics or the steroids which they will still administer may again put her into a bad state. So we got her discharged around 3 or 4 months back, and she was doing well. But because the attendants are also anxious, the children and the husband, so they wanted to keep a follow up with the doctor, the hospital doctor. So I was okay that you keep a follow up, but don't give any medicine without asking me. So they kept a follow up. The patient who was completely on a deathbed kind of state, now she was walking good, and the weakness was becoming better. She even started cooking at her house. She would do her daily chores and everything. So they went for a routine checkup after 1 month, and they did a urinary exam, and there were pus cells in the urine. So they were around 40, 50, I think, this much pus cells. And the doctor said that she's having a very severe urinary infection, so we have to give the antibiotics. So they got panicked by listening to whatever the doctor told them. I don't know, but whatever the doctor told them, they got very panicked, and they got her admitted again. She went to the hospital on her feet. They did a routine checkup. She was not having any symptoms. She just had some pus cells in the urine, and the doctor advised them to admit her for 2 or 3 days again, so that her urinary infection could be better. So I didn't know about this thing, because they had already taken medicine for 1 month from me, and they were keeping. So after a few days, the husband again came. So I was like, "How? Okay, how is your wife?" He said that she's again admitted in the hospital. I said, "How? She was doing so much better." He was like, "Yes, doctor, she was doing very better. We went for a routine checkup. Doctor did a urinary exam, and there were so much pus cells. So doctor advised that this could create a severe state of infection. So we had to again admit her. Doctor admitted her for 3 days, but now it is 10 days, 12 days. And again, the creatinine has gone up, and the heart has become weak. So I was very surprised. The patient is getting better. The patient was on a deathbed. What do you understand? The patient was on a deathbed. All the organs were failing after some medicine, any kind of medicine. We are not going into homeopathy, allopathy, or any this thing. I'm just talking about the common sense. So after the medicine, any medicine, the patient got back. The creatinine came from 7, and they were doing dialysis. They were doing dialysis every 5 days. They have done 3 or 4 dialysis. The creatinine from 7, it came to 1.3. The dialysis was stopped after the medicine. Patient was back to her home. She was doing her daily things, work and everything, in the kitchen, and this thing. So from the ICU, the patient has come to her this stage of health. How can we think that the pus cells, something material inside the body, is basically a very strong stage of infection? When she was in hospital, she did not had pus cells. She didn't had pus cells, but she was dying. Now she's having pus cells. Okay, something material has, and it is coming outside. If there are pus cells, they are being thrown out by the urine. So what is the problem there? So this way of looking at the patient, you are looking for everything in a microscope. You are not looking at the patient. The patient was under that doctor for past 1 month, and he knew the history of that patient. That she was on a deathbed. Now she is back to on her feet, doing her everything. There is no swelling now. Her dialysis has stopped, and still he is thinking that there is some urinary, and there are no symptoms of urinary tract infection. She is not having any burning of the urine. She's not having any smelly urine. Just the microscope, looking in the microscope. So that is what Dr. Henneman is saying here, that until and unless we keep this material state in the mind, we always think about the matter and matter and matter, and we will always keep looking for that matter as the cause of disease. We will always think that this pus cell is the cause of disease. Pus cell are the effect of the disease. Those are the results of the disease. They are not the causation. Pus cells basically formed afterwards. It was after the inflammation has already set up in. So how can we say that this is the cause? How can by giving antibiotics and taking the pus, how can we say that the patient will be healthy after it? In the reports, you might show that the pus cell had come to zero, but the patient who came walking to the hospital is now again admitted in the hospital for 10 or 12 days. So how, in a right state of mind, how the common sense tells us that the patient after giving such treatment has become healthy? But he views the disease as a something material, which after the cure is completed may still remain lurking in some corner in the interior of the body, in order someday during the most vigorous health to burst forth at its pleasure and its material with its material presence. So Dr. Hanuman is saying that they are all still keeping that material view of the disease, that it is somewhere lurking inside the body, hidden in some secret corner of the body. And when the patient will be in the vigorous health, he will be very healthy, he will be of great vitality. Suddenly, the disease will burst out and start producing symptoms. So dreadful is still the blindness of the old pathology. So Dr. Hahnemann is, like I told you, that if you want to understand the organon, you need to connect with the emotion of Dr. Hahnemann. Everywhere, Dr. Hahnemann, when he writes about the suffering of humanity, suffering of the mankind, because these things have affected him. And he wanted, okay, you cannot do to cure someone. It's okay. That can be acceptable because everyone cannot do it. But at least don't be the one to add to that suffering. At least don't add to it. If you're trying, he's not saying that cure, always cure. No. He's saying that even if you're trying, if you have this thing that I want to cure my patient, you have a good thought, good feeling that you want to cure the patient, you will get the means to cure the patient. But if you're so blind that you cannot even see that you are basically increasing the suffering of the patient, that is very bad. That is what Dr. Hahnemann was not able to take. That is what is seen in the organon sometimes in his wordings, that anger. How can someone be so blind thinking these kind of things? And still you are basically holding on to that material notion of the disease. And where have they taken us? Like I told you, this case, an example of a case. In your practices also, you might have seen or experienced this kind of thing. This is very common. The patient goes to hospital on their feet and they're coming back on a wheelchair or a stretcher. They went walking. So how can we say that we have cured the patient? So Dr. Henneman is basically, he was moved by this kind of thing, that okay, don't add to the suffering, at least do that. No wonder that it could only produce a system of therapeutics which is solely occupied with scurrying out the again the poor patient. And patient is giving the most precious thing in the hands of a physician. So the physician has to be very careful with his approach. And he's saying that because the basic thinking process is like that, when you are thinking like this, that okay, the disease will go, the symptoms are gone, but the disease still remains, and the pus cells are still there. So that means there is very severe infection going on inside. If you are keeping this still that material notion of the disease, so he said that because of this blindness toward the common sense, they are producing a system of therapeutics which is solely occupied with scurrying out. Scurrying means suffering, making the patient more suffer, making them more suffer. So aphorism 9, in the healthy condition of man, when a man is in a state of health, the spiritual vital force, the dynamis that animates the material body, organism, rules with unbounded sway and retains all the parts of the organism in admirable, harmonious, vital operations as regards both sensations and functions, so that our indwelling reason gifted mind can freely employ this living healthy instrument for the higher purpose of our existence. So here he is giving the definition and functions of the vital force, about what he is calling the vital force. So in the healthy, when a man is in healthy condition, this vital force, what is the characteristic of the vital force? The word which Dr. Hahnemann uses is spiritual. Many times this word is basically used in some religious meaning or in some meditative meaning, but there is a very basic explanation of this word spiritual, related with the spirit. The word has come from this thing, from the spirit. Uh, what is spirit? Is basically spirit. In the earlier times when the word was invented, the spirit was something which was basically running the whole thing. So that was called the spirit. Anything which we can see or which we cannot see is working, is uh, having some way of happening, that was known as the spirit. Because see, we basically humans, how we think in the form of what is being done, we think in the form of what is happening, we think in this way. Okay, this is our you can say the concept which we are living with, that there is something is happening all the time, and there has to be someone who is making it happen. Because of the Newton's that law, that whenever there is some motion, there has to be some force applied to it. So whenever we see something happening, so we know that some force is being applied. There is something which is applying some force, that is why this thing is basically happening. So but we cannot see that thing, we can only see the function of that thing. So the intelligent people at that time, they called it spirit. Spirit means which is not existent in a material form, which is not existence in material form. You can see the action of that form. You can see that the things which are happening, we are not doing it. Anyone else who I can see, hear, or feel is not doing it, but they are happening. So if they are happening, there has to be some force behind it. And that force we cannot see. We can just see the action. We can just see the result of the action of that force. So they called it spirit. So from there, the word spiritual. has come, which is like spirit, that we can see the action of this force, this vital force. We can see the result of this, that okay, now at a given time, right now your liver is doing 60 different functions. Your blood is being pumped through the miles long arteries and veins at the same time. And at the same time, millions of neurons are basically firing up in your brain to understand what I am saying. So can you imagine that you can do it? We cannot even do one or two functions at a given time. If you give me three work or four work types of work to do at a given time, I cannot do it. I can do one work at a given time, or at least or most two, if I push myself three. But so many things happening, so there has to be something which is basically running the show inside us, which is telling the liver to do these functions, which is telling the you know um, cells to regenerate, which are telling the neurons to fire in this way, which is telling the heart to pump this way. From a one small cell, we develop into trillions of cells. We don't have that kind of power. If I consciously had that kind of power, then I can control my height, I can control my weight, I can tell myself that okay, I want to be 6 feet, 6.5 feet. But we don't have that thing. So there, that is what the vital force is, which has spirit-like effect on us. We can see the result. We can see the result of that force, that something is happening in the body. All these functions are happening. So there has to be someone who is running this show. We cannot see it. We cannot see it. We cannot see how it enters the body and how it leaves the body. But we can understand the action. So that is why the word spiritual is used. Like spirit. There is a spirit which is running the show in the universe. And then the same character, a microcosm, a small part of that spirit or spirit like force is basically running the show in the man, and each and every man. So in healthy condition of man, the spiritual vital force, autocracy, it works automatically. You don't have any control over it. It has its own intelligence and it is running the show. The dynamis that animates the material body. Okay, it is a dynamis, it is an energy. It is not in a material form. Dynamis means it is dynamic in nature. It is not matter. It is vibrating, it is consonating, it is a frequency, it is like a spirit that animates, that makes this material body. Dr. Henneman, sorry, Dr. Kent, in his first lecture on the sick, he gives a very beautiful expression. He says that when a person is dead, all the matter part is there. The heart is there, the liver is there, brain is there, all the enzymes, all the hormones are there inside the body, the blood is there. Then what is that is dead? What is that is gone? The material body, because this material body is animated by this vital force. The material body is basically being moved, is put into motion by this vital force, and it rules with unbounded sway. There is no control over it. On the contrary, it has the control of the whole body. Unbounded sway. There is no bound which is being pushed on it, that you cannot use the hand, you cannot use the eye. No, it rules over all of the body and retains all the parts of organism in admirable, harmonious and vital operations. And it keeps the person in health. When a patient person is in health, sorry, when the man is in health, the function of the vital force is to keep that health maintained. So it keeps the parts of the organism in admirable, harmonious and vital operations as regards both sensation and functions. All the functions, all the sensation, it keeps in an admirable, harmonious manner. So that, why it keeps it like that? So that our indwelling, reason gifted mind, now we have a mind, third part, vital force, body, and mind. So we have a mind which is indwelling us, which is again situated in us, in the organism, and it is reason gifted. It is gifted with reason, so that we can employ this reason gifted mind, this living healthy instrument for the higher purpose of our existence, so that we can use this healthy body. There is always a question of existence, why we exist, what have we come to do. So whatever it is what we have come to do, whatever we have to do, we basically need an instrument to do it. So this body is like an instrument. This mind is like an instrument. And our vital force, our this spirit like vital force is basically keeping it in a healthy state so that we can use this instrument for higher purposes of our existence. For whatever we have come into this world, we can do that. So that is the function of the vital force in the state of health. The material organism without the vital force is capable of sensation, is capable of no sensation, no function, no self-preservation. When the body is dead, like a person has been living for 70 years or 80 years, so you cannot see any signs or symptoms of decay or degradation in him. But as soon as a person is dead, within few days, within few days, the body it decays, it degrades. So the body was kept well preserved for 70, 80 years, and suddenly within 2, 3, 4 days, the body it starts smelling, it starts degrading, it starts decaying. So the vital force was preserving it. So without the vital force, there is no self-preservation, no function, and no sensation. If the vital force is gone, this body, this material organism cannot function. It does not have any kind of sensation. If you um, use some sharp instrument to puncture the body of a dead person, he does not have any kind of sensations. He cannot do any function. He has no uh, way of self-preservation. It drives all sensation and performs all the functions of life solely by means of the immaterial being. So all this body, which whatever it is doing, whatever is happening to all the joys of the life or all the functions, all the things which we are doing, we are basically doing it because of that immaterial being in us. Because that is running the immaterial being, the vital force is basically running the show. It is producing those sensations and functions and giving us self-preservation, which animates the material organism in health and in disease also. So it is not that it only animates the person in health, but also in the disease state. Wherever the vital force can function properly, it functions properly. Wherever it has to tell the body or the physician that I am diseased, it tells in that way. We will come to that part. So there is an aphorism to footnote 10 about this thing, that the no self-preservation. It is dead and now only subject to the power of external physical world. So when a person is dead, he's basically subject to the power of external physical world. The all the things which are, the pressure, the temperature, the germs or everything, they will make the body decay. It decays and is again resolved into its chemical constituents. So the body was made of chemical constituents, the matter, and then it is decayed back to the same thing. But till that birth and till that death, the in between, the phase, the life is because of the vital force, because it is basically animating the this material organism. It is basically running the material organism. And until and unless we basically understand this thing, that is why he has given so many good examples and he has explained it in a Beautiful words. Okay, when we think about it, that it is the right thing that the body decays so fast. So what has kept the body from decaying from past 70 or 80 years? There is some force inside which has not allowed it to decay. And when that force is gone, the body again decays its chemical constituents. So we have to understand this thing as a physician, that what we are basically dealing with. We are not dealing with these material components. We are dealing with that force which is inside. When healthy, it keeps the patient or the organism healthy so that he can do something. And when diseased, that vital force needs some physician, good physician, to think about what is happening there, to think see the symptoms and give some remedy so that vital force can go back to being what it is actually meant to be. I think we will stop here, because next we will be talking about the diseased part, and it is going to take some time, because I have to we will talk it in detail, because this is very important for us to understand that how when a person falls ill, we have talked about the vital force in a healthy state, and when it falls ill, what happens is basically, because why I am saying that it is very important is because this basically gives us a platform. It is basically a route. This aphorism 11 is the route of how a homeopath has to think further. When patient is in front of me, this aphorism 11, the root, the essence of this aphorism 11, it always should come to the mind that what is happening inside the patient and what I am going to treat or cure. So we'll do that next Wednesday. Till then, if you have any questions or anything, there is something in the chat. Let me see. Kindly do not change the spoken language from English as it changes. Achha, ठीक. Uh, okay. So till then, if you have any questions, I welcome any kind of questions, all the questions. You can send it in the group, or you can send it to Dr. John Cole, Dr. Sobis, Dr. Mara, or to Dr. Jose, the doctors who are from Brazil, or you can send it to Dr. Risham, who are the admins in the group, and we can discuss all those things next time. Okay. So I hope you are all enjoying the Organon class, because I know that sometimes, listening to these things in contrast to materia medica, it becomes, somewhat a repetitive thing. But it is a repetitive thing. When we sit in the clinic, we do the same thing every day, watching patients coming up with the medicine. So the whole process is repetitive. Why this thing has to be repetitive? The organ and many things in the organ are repetitive. Dr. Hanuman says some things many times in the organ, because the more times he says, the more important it is. Why? Because he wants you to understand, and it should go to the core of a physician. Like he will be talking about this dynamis again and again and again and again, because he wants this dynamis word to go at the core of a physician, so that he can understand that you are not dealing with the matter. Matter is just a result of that dynamis getting sick. So this we have to understand, and until and unless we don't understand this thing, we will not able to think in that way. You can keep on reading materia medica, you can keep on learning or cramming the rubrics, but until and unless you think in that way, you don't understand. Like today we have understood this principle of totality. Why the principle of totality is important? So until and unless we don't know the principles, the basic thing on which any science is based, because principles are the basis of every science. If you take the Newton's laws away from the physics, you don't use them, you cannot do anything in the mechanical physics. You cannot do anything if you don't obey to those laws or principles. So similarly, if we don't obey to these principles of medicine, that is why Dr. Hahnemann has not written it organon of homeopathy. He has written it as organon of medicine. That this is how the medicine should be used, how the medical science should be used. Okay, so we'll stop the class here today, and we will see each other next week. Although there class tomorrow also in the morning. So all those doctors who are already attending the global classes. So we have a class tomorrow, but the organ class we will do it on next Wednesday. Thank you. Till then.